This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Cocado's Healthy Cuisine, and Vista Pediatrics.
As a parent myself, I remember the anxiety and uncertainty surrounding the delivery options. Should I choose vaginal delivery or opt for cesarean section? Today, we delve into the facts, myth, and some personal stories surrounding both delivery options. This is the Two Worst Moms Show, your favorite parenting show. After the break, I will introduce my guest.
This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Cocado's Healthy Cuisine, and Vista Pediatrics.
Welcome back from the short commercial break. Today, you're going to enjoy the conversation because it's my own friend and sister who is here to talk with us. She is in the person of Mrs. Linda Frimps Anderson. She's a registered general nurse at the Holy Child Catholic Hospital and also the face behind Frimps Touch. They always make me look beautiful. Most importantly, for this conversation, she is a wife and a mom of two wonderful boys. Let us welcome Mrs. Anderson.
Hey, the way you're hyping me, dear.
I have to hype you. How long have I been begging you, literally begging me to come on this show?
Oh, I think it's since July,
Look at that.
if I'm not mistaken.
You were supposed to be the first guest on my show.
I know, right?
Welcome, officially. Welcome to the Two Worst
Thank
Moms
you
Show.
so much. I'm
You
so
look
honored to
beautiful.
be in this seat.
Wow.
Yes.
I am honored to have you.
I'm glad that finally I'm on the Two West Mom Show.
So you started to come and steal my show with your beauty.
Oh, I hear.
Welcome once again.
Thank you.
So, I mean, for the purpose of the conversation, as a registered health nurse, usually
A
when my
registered
guests,
general nurse?
registered general nurse, usually when my guests come, I like to know what they do. Today is not for beauty. We'll get into beauty another time. Tell me, as a nurse, what do you usually do, when you go to work?
Okay. So a nurse is a health professional, right? Just like the doctors, just like we have doctors, we have physician assistants, we have lab technicians and all that. So as a nurse in the hospital, our role is to have a direct interaction with the patient. The doctor is always in the consulting room, and whenever the patients come to the hospital, we are the first point of contact. So that is why whenever a patient comes to the hospital, they'll be like, okay, mommy nurse, me pay way, mommy nurse, because we are always the first point of contact.
That's true. So that's
So
what you
our
do.
role is to give a direct interaction or care to the patients when they come to the hospital.
That's wonderful. With your beauty and all that, I know the patients will get healed as soon as they see you.
That's what they say.
So now let's delve into today's conversation.
Okay.
We are talking about vaginal delivery and CS. I mean, out there, people have their own opinions. No matter what you say, somebody has something to say about either, methods. I want you to tell us the differences, okay, between vaginal delivery and CS in itself.
Okay. So, a woman after conception will have to go through the journey of pregnancy for a period of 9 months, right? And Usually, when a pregnant woman visits the hospital for a first time, she's asked to go through a series of labs and then scan. When you go for your first scan and you present the results to your health practitioner, they'll go through delivery methods with you and how the possible outcomes of the pregnancy, the possible things to expect during the pregnancy journey. So it gets to a point in the life of a pregnant woman, you are left to decide whether you're going for vaginal delivery or CS. But bear in mind that that's not solely your decision. The decision actually lies between you and the doctor, depending on the medical circumstances surrounding the pregnancy. Yes. So it's not your decision, or it's not your choice to decide that, okay, I want to go for vaginal delivery or I want to go for CS. Okay. Unless there is a serious medical condition surrounding the whole pregnancy, that will entreat or that will compel the doctor to decide that, okay, because of this condition, we'll have to go in for CS. But usually, if there is no medical complication surrounding the pregnancy, you are required to do a vaginal delivery. So today we are going to talk about the differences between the two. Now, let's talk about CS. So CS is an abbreviation for the word cesarean section. And it usually involves an incision from the skin through to the abdominal muscles to the uterus in order to deliver the baby. And it's usually opted for, especially when there is a serious medical condition or there's a complication surrounding the natural delivery method. We also have vaginal delivery, which is the normal or natural, what we term the natural birth, which is delivery of a baby through the birth canal or the vagina. So basically, these are the key differences between the both of them. We also have differences depending on the recovery time of both. With CS, the recovery duration is usually longer.
Okay.
Because there's a wound, there's a cut. But with vaginal delivery, the recovery period is shorter. So you realize that after vaginal delivery, the woman is usually able to do her normal daily activities as compared to the CS.
Yeah, that's true.
Yeah.
I mean, I've experienced both, so.
Oh, you've experienced both?
Yeah, I've experienced both. My first and second, I pushed. And then with the last baby, I had the CS, so I think I can really relate to what you're saying. So by incision, you mean cut, eh?
Yes.
Incision means cut.
Yes, incision means cut.
Okay. So the CS, like you were saying, some people opt for it due to some medical conditions. But me too, I know people who didn't have any medical condition. So I just want to know, do you think there are benefits? Somebody told me that, and this was funny, but let me just share with you. Somebody told me that the CS kits, because they don't push them out through the vagina, the vagina sort of squeezes the head of the baby.
That's true.
And because of that, the CS kits are very smart. And that's the kids who are pushed out, you need brains, That's shaking.
Well,
but that's just, by the way, I just want to know whether there are some benefits, to giving birth via CS.
Okay, I would say that usually CS becomes beneficial to the mother when there is a serious condition attached to it, like hypertension, diabetes, or conditions related to the heart. Because with those conditions, you cannot possibly go through a normal delivery because let's take the hypertension, for example. The high blood pressure in the vessels of the mother will not allow the mother supply enough blood to the baby, which will impede oxygen supply to the baby. So as a result, you wouldn't possibly want to wait till you are full term before you deliver. So usually when when cases like that or medical conditions like that set in, it means that we'll have to deliver the baby preterm. We can't possibly wait till you are full term before we do the delivery. So in such cases, CS becomes beneficial to the mother. You understand? Yes.
So in the same vein, do you think there are benefits to vaginal delivery?
Yes, I would say there are benefits in vaginal delivery because, you know, most women do not like the idea of CS because they are actually going under the knife. And there are a lot of stories, strange stories surrounding CS. Okay. So people usually are comfortable with vaginal delivery. So I'll say there are benefits, or yes, there are benefits to vaginal delivery because it actually reduces that stress. It brings down the stress of thinking about how dangerous or complicated CS might be to you. And people even fear that once they enter the theater, they might not come back. So it just
Since you're talking about this fear, let's go into, just be honest with us, because you usually do that. You work with the doctors on the CS, right?
yes.
Just be honest with us, with parents. What are some of the complications, okay, the risk that are associated with CS?
So gone are the days where there were so many stories surrounding CS, where people believed that once you enter the theater room, you are given an anesthetic agent or some medication for you to fall asleep first so that the procedure can go on. And so there were even stories that some people go through the surgery and then go into coma and they do not even come back alive. So there was that fear, but now it's been made so simple because usually the anesthesia is given such that whilst the procedure is ongoing, you are even awake. And sometimes the doctors will be communicating with you, the anesthetist will be communicating with you. And there are instances where you are even asked, oh, which church do you attend? So will you give birth again? So sometimes it even becomes fun in the theater room. So the only risk associated with CS is the fact that there is a cut or a wound. And so if you do not take good care of the wound, if you don't manage the wound well, there might be the risk of infections. And when an infection sets in, you are likely to come back. It might get so bad that you are likely to come back for them to open you up again.
We'll go into that. I'm really interested in that. But in the meantime, both delivery methods, how can moms prepare? I know that CS is on another level.
Yeah.
So I'd like you to, share how mothers can prepare for that. And even with the vaginal, how they can prepare mentally, or even physically, anyhow, to give birth to that.
Okay. The first thing I would say is that you have to psych your mind. You have to psych yourself that, okay, I am no longer that single girly person. I am now a mother. So once you position yourself on that side, you are able to actually sink it in so that you are able to face that final day when it comes. So first of all, psych your mind and then visualize the positive outcome of the delivery, the birth of your child, the fact that you're going to finally meet your baby, the fact that you're going to meet your own kind, and meaning you can actually ease your mind towards the delivery, whether it's CS or vaginal delivery.
How was your experience? You've had CS twice?
Yes, I've had CS twice.
How did you feel? What were you thinking the first time?
Okay, for my first pregnancy, my husband and I really wanted vaginal delivery. Because honestly, looking at the stories surrounding CS, I wouldn't want to go in for CS.
Even you as a nurse?
Yes, even me as a nurse.
Okay.
Even though I am actually by the side of patients helping doctors carry out the procedure, but myself, the sight of it and how it even feels like after the anesthesia fades away.
The pain.
The pain and all that associated with CS. actually, I wasn't interested in CS. My husband and I were not interested in CS. So our initial plan was to go in for vaginal delivery until I got to the labor room and I was in labor, and I was not progressing. I was not dilating. I think I dilated up to 3 centimeters. And then the doctor instructed to induce me. And after the first induction, it failed. The second induction failed. The third induction failed.
I heard the induction is very painful.
It's painful. I can say it's even painful as compared to the labor and delivery itself.
What? Really?
Induction is so painful.
But you were in labor?
Yes, I was in labor. Just that I was not progressing. You know, when you're in labor, there is a measurement to it.
Yeah.
Your birth canal has to open up.
Yeah.
It has to be opening up from 1 cm to 2 to 3 up to 10.
10, yeah.
So when you get to 10, then now we can say you have fully dilated.
Yeah.
Or you have fully opened up. And so we are ready to take out the baby. But then in my case, I graduated to 1, I progressed to 2, and then to 3, and I was not progressing anymore. So they had to induce me.
And they induced you 3 times?
3 times, and then it all failed.
What?
So at that point, we knew that definitely we are going in for CS. And that fear alone made me anxious. So that was my experience. We totally did not want to go in for CS, but then we were compelled to because of what happened in the labor room.
So it means you didn't prepare for it mentally?
I was not prepared for CS.
And how did that affect you?
I think it really did affect me because, first of all, you know, when you're going for CS, you're supposed to fast for at least 6 hours. So because I had not prepared for CS, I ate. You know, my mom was like, okay, Obadia Okowa, you need to eat something heavy. Yeah. So she gave me banko and oko. And now I was not progressing, so they had to rush me to the theater room. And I had eaten banko and oko. So you can imagine what was happening. So the doctors had a hard time. The surgical team had a hard time because of the food. But then it still was successful anyway. But then I was nervous whilst on the theater bed because usually before CS, some few days to your CS, you have to come for anesthetic assessment where the anesthetist is going to ask you several questions and then also to ease you down, to calm you down, to reassure you that the procedure is going to be successful and that it's not scary or yes. But then I didn't have that opportunity. I didn't have the opportunity to go through that. So I was still so anxious. I was heavily afraid. But then once I got on the theater bed and the doctor cut me and I was not feeling the pain because of the injection, the anesthesia given. That was when I was like, okay,
I'm going to let you hold on. And then we're going to go for a quick commercial break. When we come back, we are still here with Mrs. Linda Frimps Anderson.
This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Kokado's Healthy Cuisine, and Vista Pediatrics.
Welcome back from the short commercial break. We are talking about CS versus vaginal delivery, and with us here in the studio is Mrs. Linda Frimps Anderson. She is a registered nurse with the Holy Child Catholic Hospital right here in Takrady. She's telling us so many things about both delivery options. So stay tuned as we continue the conversation. So Mrs. Anderson, now I want you to tell us, give us some tips with both methods, both CS and vaginal delivery.
Mhm.
How is a recovery like, and what can both parties do during their recovery period to make sure that they recover very well?
Okay. Like I said earlier, the recovery duration for CS is usually longer. It
Mm,
takes it takes a longer time for a CS wound to heal,
mm.
and it takes a shorter time for the vaginal delivery
Okay,
recovery.
okay.
Uh-huh. So let me talk about the CS first. Because healing in CS usually is longer, it has a longer duration. We advise that women after CS will have to eat very well. You have to eat a well balanced diet.
Like fufu and palm soup.
Exactly,
Okay.
because that will even help in breast milk production.
The fufu.
Myself, using myself as an example, not fufu per se, but then the palm nut soup actually helped boost my breast milk production.
Mm,
Uh-huh.
mm.
Yeah, so back to what I was saying. Because of the longer healing period, it's always advised that you eat very well. You eat a well balanced diet,
Okay.
especially foods rich in proteins, because remember that proteins help in building body tissues. They
Okay.
help in the buildup of body tissues.
Okay.
And remember, you have a wound. There's a cut, and so eating a lot of proteins will help you build the tissues back. As well as eating a lot of fruits and then vegetables, because we all know that fruits and vegetables are also rich in vitamins, and vitamins also help to boost immunity. So whilst the proteins are helping to build up tissues, the vitamins are also helping boost immunity for healing to occur faster. But it doesn't change the fact that the wound healing takes between 6 to 8 weeks.
And that is different with the vaginal.
Exactly.
Okay.
Because with a vaginal delivery, nothing much has been done. It doesn't really require serious medical intervention or surgical intervention. It's just going through the natural process where the body in itself is in labor, and so you just flow with the body's natural physiology in going through labor. And then once the baby is out, you go back to normal. You're back to yourself. Just that because of the hormonal changes and other things that took place, like the cutting, removal of the placenta and all that, the uterus is probably wounded a little, but then it always heals after some few days. So usually vaginal delivery, vaginal delivery recovery is within a period of 4 to 6 weeks.
Okay.
Yes,
But then CS is 6 to 8 weeks.
6 to 8 weeks. And also another difference is that with a CS, you'll be asked to stay away from sexual activities because of the cut, the incisional sites, and the pain associated with CS.
But what will happen?
Doing vigorous activity might lead to the incisional site gaping, and you wouldn't want that to happen.
Okay.
And sexual activity involves that. You
Okay,
understand?
okay.
So you have to stay away from sexual activity for the wound to fully heal. But with vaginal delivery, people return to their normal sexual
But then
activity.
even with vaginal, they still tell us to wait 6 weeks. Or are you giving us the go ahead?
Oh no, not necessarily.
Okay.
Myself, I was so much in a hurry. Myself, I was so much in a hurry that even after the CS, I couldn't wait for like 3 weeks.
You don't say.
I started.
Okay, so
I don't encourage that though.
all right.
I
then,
don't
all right. I
encourage
mean, you
that.
are a health professional.
It's just a
so-
confession.
Yeah. So still on vaginal, are there other things they can do for? Can they also be eating what you recommended for the CS?
Yes, it's same. It's actually same. You have to eat for yourself, for your own well-being. Because there's no wound, you're not really required to be on a strict diet. For CS, For CS, I forgot to chip in this. For CS, within the first few weeks, because of the fact that you wouldn't want to create pressure in your abdomen and all that, you are required to eat fiber diets, foods containing fiber,
Yeah.
so that you wouldn't have to experience constipation. Because remember, eating bread and yam and the likes might
cause you to constipate.
exactly.
Yeah. Yeah.
So you are required to eat fiber diets and lots of vegetables and fruits, as well as hydrating yourself a lot with water and liquids, other liquids, so that you can have free stools.
Now, still on that, how can moms who are about to give birth, or even let's say postpartum, how can they manage the pain? You keep saying that the vaginal, there is no wound, there is no wound, but there is a wound because sometimes I had it wasn't planned, but I ended up having an episiotomy
Yes,
with both
that's
children.
different.
It cut, it tore. They didn't cut, it tore.
Okay, it's on.
Yeah,
it's
it tore on its own. And they had to, mend both
C-try.
times. Both
Okay.
times I pushed. And that was also, a wound on its own. So now let's talk about the pain. After CS, excruciating pain. And honestly, let me just get this across. I don't know why people think women who do CS, they don't experience any form of pain,
That's
and that
not
they don't
true.
want pain. That's why they opt for CS.
That's not true.
Because if you ask me, after experiencing both, CS is painful, ladies and gentlemen.
Very painful.
It is very painful. I mean, I like the fact that with vaginal, I pushed, and within, like I say, in some few weeks, it was okay. But with CS, whoosh, you can't walk. You need help to do this. Well, I just want you to, take us through how moms can manage the pain, the CS pain. Okay, when the anesthesia, is that the name? When the anesthesia wears off, and then with vaginal too, if the woman had experienced episiotomy or any form of tear, all that pain, how can they manage it? What are some of the things they can do?
Okay, I will always begin with the fact that as a woman, once you deliver, I was already share with you say, hey, yeah, there is nothing like um after delivery there is no pain. Hey, yeah.
Yeah.
But then we find ways and means to manage them. So I advise that after psyching yourself, you adhere strictly to your pain analgesics or pain medications, because usually after both deliveries, your doctor will prescribe medications for you, pain medications for you. I know they are not enough, but then at least once you adhere to them, it will help in some way.
And while that is going on, I almost got addicted to pain meds after having my
After
second.
the CS?
No, not that. After my second, because of the whole tear thing, the pains were so unbearable. And there's a particular medicine I don't want to, there's a drug I don't want to mention. The doctor gave to me, the gynae gave to me, and I realized that as soon as I took, the pain went down.
So you're getting addicted?
Yeah, I was getting addicted. And then I started getting severe headaches. So my husband just advised me to stop. So I'll just say that the pain meds are good, but don't overtake them.
Yeah, that's true. So especially for vaginal delivery, you can do some sitz baths where you warm some water up and then keep it in a pail or a bucket, a plastic container, and then you do some sit-ups gradually.
You do sit-ups on the bucket.
On the bucket. So that it helps. It also helps ease the pain in some way. Sometimes too, you can apply some ice cubes. So you can manage it by doing all of that. And for the CS, the pain is excruciating, just like you said. If you need help, you will have to seek for help. Because of the pain, you can't do a whole lot of things on your own. So you have to seek for help sometimes in situations where you think you can't do it all.
That's a lot. You said a lot.
Yeah.
I'm just going to ask you to give your final word to expectant mom. those who are opting for CS, those who are opting for vaginal delivery, what will be your final piece of advice to both of them?
Okay, so I'll say that the pregnancy journey in itself can be so overwhelming. I mean, you and I are mothers. We've been through it and we know how it is. It can be so overwhelming. However, I always advise that you need to keep an open mind, okay? And then discuss the pregnancy journey and both delivery options with your healthcare provider, your gynecologist or your midwife. Discuss both options with them, and always bear in mind that it's not your sole decision to say, okay, I'm going in for CS or vaginal delivery. I mean, the most important thing here to consider is the safety of the baby and the safety of the mother. So in the end, the mother should come out alive and the baby should come out alive. I want to pass this instance before I conclude. I give my final thoughts. So there's this client of mine. We were having a conversation about CS and vaginal delivery, and she told me that during her time, her mom told her, say, Akosia, I'm using a different name because I don't want to mention anyone's name here. So her mom told her, say, Akosia, Shana one call for CS because CS, so back for CS, not just say on your back. You understand? So there's that wrong perception.
So what she said was, if a woman, the mom, your client's mom said, if a woman goes in for CS, it means she's not a real woman.
She's not a real woman.
Okay.
So being a real woman actually comes with you pushing, going through the labor and everything, and then pushing out the baby. That's when
they see you as
see you as a real woman. So in fact, it was a hard time for her because her mom was giving her that pressure. And I was like, hey, no, it shouldn't be like that, because when you go and there is a complication and there is a need for you to go to the theater, you have to, because the life of your baby and yourself is very important to you. Okay, what if you adhere so much to what your mom is saying and then in the end you lose the baby and probably lose your life? So my general advice to expectant moms is that take it easy on yourself with regards to deciding whether you are going for CS or vaginal delivery. Okay, discuss with your surgeon, discuss with your doctor or your midwife which of the options will be best for you. It can change. You might choose vaginal delivery, it can change. You might choose CS, it can change. So just accept whatever comes up. Yes.
So do you know what I usually tell people who claim they are against CS or anything unnatural? I just tell them that then don't use your blender, don't use your microwave, don't use your washing machine, because they are equally unnatural.
In fact, don't pomade after you bath.
Yes. Thank you for sticking with us through this segment. And we want to give a quick shout out to our sponsors. We are proudly sponsored by Cocados. They have salads, detox packages, smoothies, Greek yogurt, parfait, granola, wraps, sandwiches, juices, and the famous bougie Burkina, aka Brooks. You can call or text Cocados on 0541 022 896. Appearance, trendy wardrobe, and kitchenware, my favorite place to shop for both, clothes and kitchenware. They have microwaves, kitchen stands, non-stick saucepans, everything and anything you need in your kitchen. Appearance Trendy has it, blenders, kettles, you name it. They also have kids dresses, outing dresses, corporate dresses, casual dresses, anything for men, for women, for kids. They are all available at Appearance Trendy. Call them or WhatsApp them on 0208 759 436. Now, Vista Pediatrics is the leading children's clinic in the Western and Central regions. They are located at Fijai near the NK nightclub. Contact them on 0534 966 283. My beautiful makeup, as always, is by Frimps, and today the CEO happens to be here. And my beautiful attire it's from Tayari by Lamy. You can call them on 0243 20547. Now, Tayari by Lamy, they target plus size women like myself. So if you want something you can feel so comfortable in, you can contact them. After the break, we'll come your way with the playground.
This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Cocado's Healthy Cuisine, and Vista Pediatrics.
Welcome back from the short commercial break. In fact, rewind. Welcome to my favorite segment where I get to be queen, where I get to win. This is the playground, and today we'll be playing the Dress a Doll game. Okay, now this segment is sponsored by Universal Garments. You can call or text them on 0543 430055. They can be found at Intraban Junction, close to Shama. They made these soft dolls that we are going to use for this segment. Mrs. Anderson.
Mm-hmm.
So this is Adum, my favorite doll. So the doll is called what?
Yeah.
Okay. So this is Adum and this is Ya. And we're going to dress them up. We're going to play pretend and pretend they're going to school.
Okay.
So the person who dresses them up quickly, if you win, praise the Lord. If I win, you have to give me 100 cedis.
So if I win, what do you do?
I said, praise the Lord.
No.
I'll say congratulations. Okay. So once they give us the go ahead, we are going to start.
Okay.
So producer. Okay. We are good to go. Let's start. So Linda, usually in the morning, I know who dresses your kids.
Yes.
You dress both of them.
Yes, I dress both of them for school.
Wow, where did you learn how to dress kids for school?
I think it comes naturally.
Does it?
Yes. Hey.
Yeah, but relax, I'm trying to distract you. Please allow yourself to be distracted. So what did you have for breakfast this morning?
I'm not eating, my sister. I'm not eating, I'm so
I'll take you to
hungry.
Cocados from here, don't worry.
All right. I can't wait. Hey. And then you can also banana.
So,
You can open my time.
please, if you don't dress the doll well, we'll not give you the award. Hey, why are you winning like this?
I'm full of surprises.
Hey, Adum, today, why? Adum, you're not doing me show today.
Oh, yeah.
Oh, no.
We are done.
Oh, no.
Oh, my God.
Oh, no.
Yeah.
No. She's not currently dressed.
Yeah, she's dressed.
She's not. If you like, remove the dress and let it fix the diaper.
I just won, guys. I just won.
No, but she's not dressed currently.
She's dressed. She's dressed.
Raise it, let's see.
No, what am I supposed to do again?
Raise it.
She's dressed. She's properly dressed.
Raise the dress and let's see the shot.
That's it.
Oh.
She's dressed.
Oh, so you won.
Yes. I've won. I always win.
Oh, finally there is somebody who always wins.
You can ask Jumek. I always win.
Ladies and gentlemen, this is sad. See you at the bridge.
This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Cocado's Healthy Cuisine, and Vista Pediatrics.
Now, welcome back. And don't be fooled by the fact that I'm smiling. I'm very, very sad because Mrs. Anderson is just here jubilating that she won. I'll bring her back and I'll put her back to the ground. Anyway, Mrs. Anderson, thank you for passing through.
You're welcome.
We are grateful. Money can build a house for you.
Mm-hmm.
So, Cocados has taken it upon themselves to refresh you for us.
Oh my God.
To help you stay healthy and energized. Because we know you're going to work from here, right?
Yeah.
We want you to fill your tummy. Now here we have some Brooks. We have some Funky Spin, one of my favorite juices from Cocados. And then we have some sandwich. To say thank you for taking time.
Thank you.
come
Thank
here.
you so much, Cocados. And thank you, the Two West One Show.
You are welcome. Thank you for sticking with us today. Thank you to Cocados for always supporting us. Thank you to Appearance Trendy Wardrobe and Kitchenware. Auntie Vivian, we love you so much. Thank you for always supporting us. Thank you to Vista Pediatrics, all the staff at Vista Pediatrics. Thank you. Thank you to Frimps, to the CEO boss herself. She's here. Thank you for always making me look beautiful. Thank you to the CEO of Tayari by Lami. I am forever grateful for these beautiful pieces that you've given me to wear on this show. So viewers, please patronize her. Thank you to my production team, to Lady Grace, to Dorcas, to Sammy, to Uncle Mark, to Ojozi. I am super grateful to all of you. Same time next week. See you.
This program is proudly brought to you by Appearance Trendy Wardrobe and Kitchen, Cocado's Healthy Cuisine, and Vista Pediatrics.